A lot of charges being flung around here and there. We are now joined by Congressman Phil Gingrey, a Republican from Georgia, a supporter of Mitt Romney in the campaign. He's also the chair of the GOP Doctors Caucus. And Congressman Gingrey, there is a lot of discussion about the so-called Ryan plan. He is the #2 person on this ticket, though. On top of the ticket is Mitt Romney. And yesterday, Mitt Romney was asked about the differences between his own Medicare plan and that of Paul Ryan. Let's listen to what he said.
Sure. I'm sure there are places that my budget is different than his, but we're on the same page, as I said before. We want to get America on track to a balanced budget. There may be. We'll take a look at the differences. Well, the items that we agree on, I think, outweigh any differences there may be. We haven't gone through piece by piece and said, oh, here's a place where there's a difference. I can't imagine any two people, even in the same party, who have exactly the same positions on all issues.
So Congressman, what are the differences between the two plans, and would you like to see Mitt Romney give a more fulsome embrace of the so-called Ryan plan?
Well, there may be some differences, some rather subtle differences in their plan. It's the same game plan, even though you may have a different center fielder. The straw that stirs this drink, obviously, is Mitt Romney. He is going to be the next president of the United States. Paul Ryan is going to be vice president of the United States. And I think they'll get together on tweaking around the edges in regard to the plan. But it's essentially a very similar plan, and that is that you have to face up to the reality of these entitlement programs going off a cliff. And that's what the Romney-Ryan plan will do. That's what the House Republican budget has done for the last 2 years. We know the Democrats have no plan and have no budget for the last 3.5 years. So I'm so happy about the choice of Paul Ryan as Mitt Romney's running mate. I
was talking to a couple Democratic strategists overnight who are not actually affiliated, by the way, with the Obama campaign, and in some cases they're actually running races where they're positioning their Democrats in opposition to the president. But they do say that the so-called Ryan plan is like manna from heaven for them. They are running against it hard. They intend to put new ads up as soon as they possibly can. The Democrats truly see this as a winning issue for them. Are they wrong?
They're absolutely wrong. This running away from reality is not going to get it with the American people. And the American people understand. The CBO has said it. The Medicare trustees have said it. Medicare is insolvent by 2022. And it is so totally irresponsible to ignore that reality. And indeed, in creating this new entitlement program called the Affordable Care Act, the Unaffordable Care Act, i.e. Obamacare, they gutted the Medicare program of $720 billion to create a new entitlement program for the young. When we were marking that up in committee, I had an amendment that said, okay, any Medicare savings, it goes back into Medicare. And the Democrats led by Waxman and Pelosi, they rejected that. They didn't want to save Medicare. They're gutting it.
One of the things that Paul Ryan has suggested over the years would be all but eliminating Medicare and replacing it with a voucher system. So there are a lot of charges going back and forth here now.
But premium support is not voucher. A voucher would be you hand money to a senior and say, hey, go find your health care. This would be run by the Medicare trustees, by CMS, Committee on Medicare and Medicaid Services. The money would stay there. The premium support would be more for someone who comes into Medicare with pre-existing conditions, and it would increase as a senior ages. And last but not least, it is the Ryan Wyden, Democratic Senator Ron Wyden's plan, and strictly voluntary. If a senior wants to stay on the program, a fee-for-service, traditional Medicare, they can and will do that. In fact, they will be required, essentially, to do that if they're over age 55 or already on the Medicare program.
Congressman, there was a great deal of enthusiasm over the weekend with this announcement. The pictures were terrific from the campaign trail. So a lot of people, I think, were a little bit surprised to see some polls that came out yesterday which talked about the relative enthusiasm in the voting public for the Paul Ryan pick. And I want to read you some of these poll numbers right here. According to USA Today Gallup, only 39% of voters rate the Ryan pick as excellent or pretty good. 42% say it's only fair or poor. And among independents, which is a key voting bloc, 35% say it's excellent or pretty good, and 43% say it's only fair or poor. Don't you need these independents? And if Paul Ryan's not helping among them, aren't you in trouble?
Well, it would indicate, of course, at this point in time, the Democrats are doing a pretty good job of continuing to scare seniors But the only poll that really matters, as you know, John, is that poll on November the 6th, and we get the final count. We're going to have a 45th president. We're not going to have a repeat of the 44th failed presidency where he put an additional $5 trillion on the debit side of the ledger and 43 months straight of unemployment above 8%. This is a failed president. The American public are not going to accept that. We need bold plans, and we need honesty with the American people. That's what they have not gotten from Barack Obama.
Congressman Gingrey of Georgia, thank you very much for joining us this morning.
John, thank you for having me.
It is now 34 minutes after the hour right now, and it's 7 a.m. Eastern on Starting Point. Soledad O'Brien will be joined